Question 1. In the context of radiation interactions with matter, Mr. Harris is studying the photoelectric effect and its implications in nuclear medicine. He is analyzing a sample where low-energy photons interact with an atom, leading to the emission of an electron. What would Mr. Harris observe regarding the energy of the emitted electron? A. The energy of the emitted electron is approximately equal to the energy of the incident photon. B. The energy of the emitted electron is equal to the energy of the incident photon minus the binding energy of the atom's electron. C. The energy of the emitted electron is determined by the difference between the binding energy and the incident photon energy. D. The emitted electron energy is independent of the incident photon energy. Answer. Correct answer. B. Explanation. The photoelectric effect involves an incident photon transferring its energy to an electron in an atom, ejecting it from its orbit. The energy of the emitted electron is equal to the incident photon energy minus the binding energy of the electron in the atom. This phenomenon is critical in understanding how radiation is absorbed in nuclear medicine imaging systems like gamma cameras. When the incident photon energy is and the electron's binding energy, the difference in energy is carried away by the ejected electron. Question 2. Given the circumstances of a nuclear medicine department using I-131 for thyroid treatment, which of the following principles of radiation safety would be the most effective in minimizing the exposure to the patient, medical staff, and the public? A. Use of high shielding materials around the patient during treatment. B. Adopting personal dosimeters for each medical staff member involved in the procedure. C. Ensuring that radiation protection protocols are strictly followed, including ALARA principles, and maintaining safe distances. D. Only administering I-131 to patients over 70 years of age to minimize exposure. Answer. Correct answer. C. Explanation. The ALARA, as low as reasonably achievable, principle is a fundamental radiation protection guideline aimed at minimizing radiation exposure to patients, staff, and the public. In the case of iodine 131 therapy following ALARA by using appropriate shielding, maintaining safe distances, and ensuring proper protocol compliance is essential, while personal dosimeters and shielding are critical components. The most effective approach is always ensuring that radiation exposure is minimized through a combination of practices including distance and time. Question 3. When analyzing the decay scheme of a radioisotope used in PET imaging, Dr. Michaels observes that a positron is emitted during the decay process. Which of the following describes the role of this positron in the detection process? A. The positron directly contributes to the image resolution by interacting with nearby electrons. B. The emitted positron undergoes annihilation with an electron, producing two 511 keV photons that are detected. C. The positron is absorbed by the surrounding tissue without contributing to the imaging process. D. The positron energy is directly proportional to the patient's metabolic rate and provides diagnostic data. Answer. Correct answer. B. Explanation. In PET imaging, positron-emitting radioisotopes decay and emit a positron. This positron travels a short distance before annihilating with an electron, resulting in the production of two 511 keV photons that travel in opposite directions. These photons are detected by the PET scanner and used to reconstruct the imaging data, creating detailed images of metabolic activity within the body. Annihilation process is key to PET scan operation and is central to molecular imaging. Question 4. Dr. Edwards is performing routine quality assurance (CAR) procedures for a gamma camera in a nuclear medicine facility. Which of the following performance metrics should be prioritized to ensure optimal image quality and detector functionality? A. Ensuring the camera operates within the prescribed temperature range for optimal performance. B. Calibrating the camera to correct for any variations in energy resolution and sensitivity. C. Maximizing the field of view, even at the expense of resolution, to capture more anatomical areas. D. Increasing the photon count rate for faster scanning, which may reduce overall image quality. Answer. Correct answer. B. Explanation. In gamma camera performance assessment, calibration is essential to ensure that energy resolution and sensitivity are maintained at optimal levels. Variations in these parameters can lead to reduced image quality, affecting diagnostic accuracy. Calibration helps correct for inconsistencies in the system's response to radiation and ensures consistent image quality. Temperature and field of view considerations are important, secondary to the core requirements of calibration and performance metrics. Question 5. Which of the following best describes the primary advantage of hybrid imaging systems such as PET compared to standalone PET or MRI systems in nuclear medicine? A. Hybrid systems improve the spatial resolution of PET imaging while maintaining high soft tissue contrast from MRI. B. Hybrid systems reduce the radiation dose required by using MRI to eliminate the need for radiopharmaceuticals. C. Hybrid systems provide higher quality PET scans by relying on MRI's magnetic field for improved photon detection. D. Hybrid systems primarily serve as backup imaging technique, emergency scenarios where PET scanning is unavailable. Answer. Correct answer A. Explanation. Hybrid imaging systems like PET recombine the strengths of both modalities, offering superior anatomical resolution from MRI and functional imaging from PET. MRI provides excellent soft tissue contrast, while PET offers metabolic information, making them complementary in clinical applications, especially in oncology, cardiology, and neurology. This combination enhances the overall diagnostic capabilities of imaging, improving both spatial resolution and the accuracy of the functional data provided by PET. Question 6. Considering the evolution of imaging techniques Optogrant is evaluating, a new SPECT scanner that uses contrast agents to improve image quality. Which of the following improvements is most likely due to the use of contrast agents in SPECT imaging? A. Increased photon flux leading to a higher number of detected photons. B. Enhanced contrast between tissues with different radiopharmaceutical uptake, improving lesion detection. C. Reduced patient exposure to radiation by lowering the administered dose. D. High temporal resolution, allowing faster imaging of dynamic processes. Answer. Correct answer. B. Explanation. Contrast agents in SPECT imaging help to improve the differentiation between tissues that take up the radiopharmaceutical differently. By increasing the contrast between normal and abnormal tissues, such as tumors or areas of inflammation, contrast agents improve lesion detection and enhance diagnostic accuracy. While photon flux and temporal resolution are important, contrast agents primarily help enhancing tissue differentiation. Question 7. Mr. Thompson is studying the principles of radiation safety and the handling of radioactive materials in a nuclear medicine lab. What would be the most effective strategy for reducing exposure to radioactive contamination during radiopharmaceutical preparation? A. Always handle radiopharmaceuticals in open containers to avoid the buildup of pressure. B. Use lead shielding around radioactive materials to block radiation during all stages of handling. C. Implement a protocol that includes the use of personal protective equipment (PPE) and designated containment areas for handling. D. Store radiopharmaceuticals in unventilated areas to prevent the release of radioactive gases in the laboratory. Answer. Correct answer. C. Explanation. The most effective strategy for reducing exposure to radioactive contamination is to follow established safety protocols, including using personal protective equipment (PPE) and ensuring the use of containment areas during the preparation and handling of radiopharmaceuticals. This minimizes the risk of contamination and ensures that radiation exposure remains as low as possible. Lead shielding is important, but containment and PPE are essential for overall safety. Question 8. During the process of image reconstruction in SPECT imaging, Optoliu decides to apply iterative reconstruction methods. Which of the following is a key advantage of using iterative reconstruction over filter back projection (FBP)? A. Iterative reconstruction reduces computational time, making it faster than FBP. B. It provides a more accurate reconstruction by incorporating statistical models of photon detection. C. Iterative reconstruction is less sensitive to patient motion, improving image clarity. D. It requires less patient radiation dose than other methods, improving safety. Answer. Correct answer. B. Explanation. Iterative reconstruction is a computational method that adjusts the reconstructed image by iteratively comparing it with acquired data. This approach incorporates statistical models, which makes it more accurate in dealing with issues such as noise and partial volume effects. It offers significant advantages over filter back projection, including higher image quality in terms of contrast and resolution, especially low count situations typical in nuclear medicine imaging. Question 9. What would happen if a nuclear medicine facility failed to properly calibrate its radiation detectors for daily operation? A. The detectors would produce inaccurate readings, potentially leading to misdiagnosis or improper treatment. B. The detectors would automatically adjust their sensitivity, preventing any significant impact on patient safety. C. The radiation dose administered to the patient would increase due to compensation for detection errors. D. The detectors would not be able to detect any radiation, rendering the imaging system unusable. Answer. Correct answer A. Explanation. Calibration of radiation detectors is critical to ensuring that they provide accurate readings of radiation levels. Failure to properly calibrate the detectors can lead to inaccurate imaging, potentially leading to misdiagnosis or improper treatment planning. Regular calibration ensures the detectors perform optimally, maintaining diagnostic accuracy and patient safety. Question 10. From the perspective of radiopharmaceutical dosimetry, Dr. Wilkins is calculating the dose distribution for a patient undergoing SPECT imaging with a particular radiopharmaceutical. Which factor has the greatest impact on the dosimetry calculation for this procedure? A. The half-life of the radiopharmaceutical used in the imaging process. B. The amount of radiation emitted per decay event and the energy of emitted photons. C. The patient's weight and age, which may affect the distribution of the radiopharmaceutical. D. The imaging modality used, SPECT versus PET, which determines the radiation dose absorbed by the patient. Answer. Correct answer. B. Explanation. The most significant factor in calculating radiopharmaceutical dosimetry is the amount of radiation emitted per decay event and the energy of the emitted photons. These factors directly affect the dose distribution within the body. The half-life influences how long the radiopharmaceutical remains active, but the energy and decay characteristics are more critical in determining the absorbed dose and ensuring dosimetry during the imaging process. Question 11. Given the circumstances of a radiation safety incident at a nuclear medicine facility, which of the following actions should be prioritized first? A. Decontaminating the affected area and patients. B. Evacuating the facility immediately to ensure staff safety. C. Assessing the level of radiation exposure to determine the extent of the emergency. D. Notifying regulatory authorities and initiating a public safety alert. Answer. Correct answer. C. Assessing the level of radiation exposure to determine the extent of the emergency. Explanation. In the event of a radiation safety incident, the first priority should be to assess the level of radiation exposure to understand the severity of the situation. This helps determine the appropriate response actions for decontamination, evacuation, or treatment. According to the NRC and EPA radiation safety guidelines, is critical to ensuring that the correct procedures are followed to protect staff and patients from radiation hazards. Decontaminating and evacuating can follow once the extent of the exposure is understood. Notifying authorities and initiating public safety protocols comes after initial assessment and containment actions. Question 12. When using a gamma camera, which performance metric is most crucial to ensure optimal image quality during imaging procedures in nuclear medicine? A. Energy resolution. B. Sensitivity. C. Time of flight. D. Signal-to-noise ratio SR. Answer. Correct answer. D. Signal-to-noise ratio SNR. Explanation. The signal-to-noise ratio SNR is a critical performance metric for ensuring that nuclear medicine images have sufficient clarity and detail, which is essential for accurate diagnosis and treatment planning. A high SNR indicates that the relevant signal radiation detected from the radiopharmaceutical is much stronger than the noise background interference, allowing for better imaging. While energy resolution and sensitivity are also important, SNR is directly related to the clarity of the images produced, which is fundamental for proper clinical interpretation. Question 13. Which of the following is true regarding the principle of the photoelectric effect in radiation interactions with matter? A. The photoelectric effect contributes to lower radiation doses in patients during nuclear medicine procedures. B. The probability of the photoelectric effect occurring increases with higher atomic number Z of the material. C. The photoelectric effect is more prominent at high photon energies. D. The photoelectric effect results in the production of secondary electrons with negligible energy. Answer. Correct answer. B. The probability of the photoelectric effect occurring increases with higher atomic number Z of the material. Explanation. The photoelectric effect is more likely to occur in materials with a higher atomic number Z as the interaction probability increases with the density of electrons available for interaction. This effect is important in diagnostic imaging and radiotherapy, where the attenuation of radiation in the body impact imaging quality at higher photon energies. However, Compton scattering becomes more prevalent, overshadowing the photoelectric effect. Understanding these interactions helps optimize imaging techniques and dosimetry in nuclear medicine. Question 14. In the context of quality control (QC) for radiopharmaceuticals, which of the following is typically tested to ensure safety and efficacy before clinical use? A. The radiopharmaceutical's energy emission spectrum. B. The sterility and pyrogenicity of the radiopharmaceutical. C. The half-life of the radioisotope in the radiopharmaceutical. D. The cost-effectiveness of the radiopharmaceutical production. Answer. Correct answer. B. The sterility and pyrogenicity of the radiopharmaceutical. Explanation. Before radiopharmaceuticals are administered to patients, it is essential to confirm their sterility, free from microbial contamination, and absence of pyrogens, substances that cause fever, as stipulated in the U.S. chapter for radiopharmaceuticals. This ensures patient safety and minimizes the risk of adverse reactions. The energy emission spectrum, half-life are important for clinical efficacy but are not primary quality control tests for patient safety, which takes precedence. Cost-effectiveness is relevant from a production perspective but is not related to quality control. Question 15. What would be the most important consideration when preparing a radiopharmaceutical for use in a positron emission tomography (PET) scan? A. The cost of the radiopharmaceutical and its availability in the local market. B. The stability of the radiopharmaceutical's radioactive isotope and its half-life. C. The visual appearance of the radiopharmaceutical for patient reassurance. D. The type of shielding required to handle the radiopharmaceutical safely. Answer. Correct answer. B. The stability of the radiopharmaceutical's radioactive isotope and its half-life. Explanation. In PET imaging, the stability and half-life of the radiopharmaceuticals radioactive isotope are crucial for accurate imaging. PET scans rely on the detection of annihilation photons produced when positrons emitted by the radiopharmaceutical meet electrons in the body. The short half-life of PET isotopes, such as F18, means decay quickly, and timing is essential for optimal imaging quality. This consideration directly impacts the planning and execution of the PET scan. Cost, visual appearance, and shielding are also important, but secondary to the radiopharmaceutical's radioactive properties. Question 16. In terms of radiopharmaceutical dosimetry, which of the following factors would most significantly influence the distribution of a radiopharmaceutical within the body? A. The patient's body mass and tissue composition. B. The type of radiation emitted by the radioisotope. C. The patient's dietary habits before the scan. D. The amount of shielding used during injection. Answer. Correct answer. A. The patient's body mass and tissue composition. Explanation. The distribution of radiopharmaceutical within the body depends largely on the patient's body mass and tissue composition. Factors such as fat, muscle, and organ density affect how the radiopharmaceutical is absorbed and distributed. While the type of radiation and shielding are important for radiation safety, they do not significantly affect the internal distribution. The radiopharmaceutical dosimetry calculations that predict how much radiation patient will receive are based on these physiological factors, which is why patient-specific data is critical for accurate dosimetry. Question 17. In a nuclear medicine imaging procedure, what is the primary advantage of using a hybrid imaging technique like PET? A. It eliminates the need for a radiopharmaceutical injection. B. It provides detailed anatomical and functional information in a single scan. C. It significantly reduces the radiation dose to the patient. D. It allows for faster scan times without sacrificing image quality. Answer. Correct answer. B. It provides detailed anatomical and functional information in a single scan. Explanation. The primary advantage of hybrid imaging techniques like PET is that they combine the functional imaging provided by PET with the anatomical detail from CT scans, offering more comprehensive diagnostic information. This fusion allows clinicians to correlate metabolic activity from PET with precise anatomical structures from CT, enhancing diagnostic accuracy, particularly in oncology, cardiology, and neurology. While hybrid imaging reduces scan time and improves patient comfort, its main strength lies in the ability to obtain both functional and structural data in one procedure. Question 18. Under the assumption that a patient is receiving I-131 therapy for thyroid cancer, what is the most critical consideration to ensure radiation safety during treatment? A. Ensuring the patient remains hydrated during the procedure. B. Ensuring proper shielding is used during patient transport and in treatment rooms. C. Monitoring the patient's blood pressure throughout the treatment. D. Administering a lower dose of I-131 to minimize side effects. Answer. Correct answer. B. Ensuring proper shielding is used during patient transport and in treatment rooms. Explanation. I-131 therapy involves the use of radioactive iodine to target thyroid cancer cells, and it emits beta and gamma radiation. Proper shielding is crucial to protect both the patient and healthcare workers from unnecessary radiation exposure during treatment and transport. This involves using shielding materials, treatment room, and ensuring the patient follows safety protocols to minimize radiation exposure to others. Hydration, blood pressure monitoring, and dose reduction are important aspects of patient care but do not specifically address radiation safety in the same way as shielding. Question 19. Which of the following techniques is commonly used to improve image quality in single-photon emission-computed tomography SPECT imaging? A. High-dose radiation exposure to increase signal strength. B. Use of contrast agents to enhance tissue differentiation. C. Filter back projection to reconstruct clearer images. D. Employing MRI in conjunction with SPECT scans for enhanced imaging. Answer. Correct answer. C. Filter back projection to reconstruct clearer images. The explanation. Filter back projection is a widely used image reconstruction technique in SPECT imaging. This method helps create clearer images by reducing noise and improving spatial resolution. The technique works by filtering the raw data to enhance the signal and then back projecting it into the imaging space to reconstruct the 3D image. Although contrast agents, MRI integration can be helpful in some imaging techniques, filter back projection is specifically crucial for improving SPECT image quality. High-dose radiation and unnecessary contrast agents can compromise patient safety and image quality. Question 20. To ensure the accuracy of a PET scan, what factor is most important when calibrating the PET scanner? A. The physical integrity of the scanner's external housing. B. The uniformity of the detector response to annihilation photons. C. The color of the scanner's display screen for image visualization. D. The ambient temperature of the room where the scanner is located. Answer. Correct answer. B. The uniformity of the detector response to annihilation photons. Explanation. The calibration of a PET scanner is crucial for accurate imaging, and the most important factor is ensuring that the detectors respond uniformly to annihilation photons. This ensures consistent image quality and accurate localization of radioactive traces within the body. The physical integrity of the scanner and ambient temperature may affect overall operation but do not directly impact the accuracy of the imaging data. The display screen color is irrelevant to the technical calibration of the scanner itself. Question 21. Which of the following is the most appropriate action to take if a patient accidentally receives a radiation dose that exceeds the prescribed therapeutic dose during a nuclear medicine procedure? A. Immediately discontinue the treatment and inform the patient of the overdose. B. Administer a corrective dose to balance the overdose and ensure therapeutic efficacy. C. Notify the radiation safety officer, document the incident, and monitor the patient for adverse effects. D. Continue with the treatment protocol as the overdose is unlikely to cause harm. Answer. Correct answer. C. Notify the radiation safety officer, document the incident, and monitor the patient for adverse effects. Explanation. In the case of an accidental overdose, it is important to notify the radiation safety officer immediately, document the incident for regulatory and safety purposes, and monitor the patient for potential radiation effects. The patient's well-being should be prioritized and corrective actions should be based on expert guidance. Discontinuing treatment or continuing the protocol without assessing the risks may lead to complications. Question 22. Which of the following factors has the greatest effect on the effective dose of radiation during a PET scan? A. The energy of the radiopharmaceutical used. B. The duration of the scan. C. The body mass and density of the patient. D. The type of PET scanner used for imaging. Answer. Correct answer. C. The body mass and density of the patient. Explanation. The effective dose of radiation during a PET scan is significantly influenced by the patient's body mass and tissue density. Larger body mass and greater tissue density result in increased radiation absorption, which can affect the effective dose, while the energy of the radiopharmaceutical and scanner type are important. Patient-specific factors like body composition have the largest impact on the dose. Question 23. Which of the following is an essential requirement for the proper handling and disposal of radioactive waste in a nuclear medicine facility? A. Waste should be stored at room temperature for up to a year before disposal. B. Radioactive waste must be segregated into appropriate categories based on half-life and type of radiation emitted. C. Radioactive waste can be disposed of in municipal waste facilities with minimal regulatory oversight. D. All radioactive waste can be incinerated without further safety considerations. Answer. Correct answer. B. Radioactive waste must be segregated into appropriate categories based on half-life and type of radiation emitted. Explanation. Proper handling and disposal of radioactive waste are essential for safety. Waste must be segregated based on its half-life and the type of radiation emitted to ensure safe disposal. Short-lived materials may be stored for a short period before disposal, while long-lived materials must be handled with more stringent controls. Disposal in municipal waste or incineration without proper precautions is not allowed under radiation safety regulations. Question 24. Which of the following radiation protection principles is specifically focused on reducing unnecessary exposure to radiation in both patients and healthcare workers? A. ALARA as low as reasonably achievable. B. Time, distance, and shielding. C. Dose optimization and monitoring. D. Contamination control and decontamination procedures. Answer. Correct answer. A. ALARA as low as reasonably achievable. Explanation. The ALARA principle is a fundamental guideline in radiation safety, emphasizing the reduction of exposure to radiation as much as reasonably achievable while ensuring that the benefits of the procedure outweigh the risks. This applies to both patients and healthcare workers. While time, distance, and shielding are specific protective measures, ALARA encompasses all these principles to min overall radiation exposure. Question 25. In a context of radiation oncology, which of the following is the main goal of dose fractionation? A. To minimize the total amount of radiation delivered. B. To reduce the risk of acute toxicity and allow for healthy tissue repair. C. To speed up the treatment process and reduce the number of sessions. D. To ensure that radiation is delivered to the tumor only during specific time intervals. Answer. Correct answer. B. To reduce the risk of acute toxicity and allow for healthy tissue repair. Explanation. Dose fractionation in radiation therapy is used to minimize the risk of acute radiation toxicity by delivering smaller doses of radiation over multiple sessions. This approach allows normal healthy tissues to repair between treatments while still delivering effective doses to the tumor. The goal is to balance therapeutic efficacy with patient safety. Question 26. Which of the following would most likely lead to an increase in radiation exposure to a patient undergoing a diagnostic nuclear medicine procedure? A. Using a radiopharmaceutical with a higher binding affinity for the target tissue. B. Administering a larger volume of radiopharmaceutical to reduce scan time. C. Employing a scanner with higher sensitivity and resolution. D. Decreasing the scan duration while maintaining the same radiopharmaceutical dose. Answer. Correct answer. B. Administering a larger volume of radiopharmaceutical to reduce scan time. Explanation. Administering a larger volume of radiopharmaceutical increases the amount of radiation administered to the patient. While reducing scan time is beneficial, it should not be achieved at the cost of increasing the radiopharmaceutical dose unnecessarily. Using a higher sensitivity scanner or adjusting scan time can reduce radiation exposure without increasing the dose. Question 27. Which radiation safety measure is most effective in minimizing exposure to healthcare workers during procedures involving radioactive materials? A. Ensuring that patients are fully isolated during the procedure. B. Providing lead aprons and shielding to staff working in proximity to the patient. C. Restricting all staff from entering the treatment room during the procedure. D. Limiting the use of radioactive materials to only essential procedures. Answer. Correct answer. B. Providing lead aprons and shielding to staff working in proximity to the patient. Explanation. Providing lead aprons and other shielding materials is the most effective method of minimizing radiation exposure to healthcare workers. These protective measures absorb and block radiation, reducing exposure during procedures. While isolating patients and limiting staff access are important, wearing appropriate shielding equipment directly protects healthcare workers. Question 20. Which of the following factors should be prioritized when determining the radiopharmaceutical to use in a diagnostic scan for a specific patient? A. The radiopharmaceutical's availability and cost. B. The patient's medical history and current condition. C. The radiopharmaceutical's radiation energy spectrum. D. The time of day when the scan is being performed. Answer. Correct answer. B. The patient's medical history and current condition. Explanation. When selecting radiopharmaceutical for diagnostic scan, it is crucial to prioritize the patient's medical history and current condition. This ensures that the radiopharmaceutical is appropriate for the condition being diagnosed and safe for the individual based on any pre-existing health issues. While cost and availability are practical considerations, patient-specific factors take precedence in clinical decision-making. Question 29. Which type of radiation interaction in tissues is primarily responsible for causing biological damage in radiation therapy? A. The photoelectric effect. B. Compton scattering. C. Bremsstrahlung radiation. D. Ionization of atoms and molecules. Answer. Correct answer. D. Ionization of atoms and molecules. Explanation. Ionization of atoms and molecules is the primary mechanism through which radiation causes biological damage in tissues. This process involves the removal of electrons from atoms, leading to molecular changes that can damage DNA and other cellular structures. This is the basis for both the therapeutic effects in cancer treatment and the harmful side effects in healthy tissues. Question 30. During a radiation oncology treatment plan, which of the following is the most important consideration to ensure accurate dose delivery to the tumor while minimizing exposure to healthy tissue? A. Ensuring the patient is positioned accurately and consistently during each session. B. Using the maximum allowable radiation dose to the tumor. C. Reducing the number of treatment sessions to decrease the overall radiation exposure. D. Increasing the energy level of the radiation beam to penetrate deeper tissues. Answer. Correct answer. A. Ensuring the patient is positioned accurately and consistently during each session. Explanation. Accurate and consistent patient positioning is critical in radiation therapy to ensure that the prescribed dose is delivered precisely to the tumor while minimizing exposure to surrounding healthy tissues. Incorrect positioning could lead to the radiation being misdirected, which can reduce treatment effectiveness or increase unnecessary radiation exposure. Other considerations like radiation dose and beam energy are important but secondary to patient positioning accuracy.